Hi all, my name is Jasmina Alajic and I'm an accounts manager at UK-based Erchonia Lasers Limited, subsidiary organization for Erchonia Corporation looking after their interest in Europe, Middle East and Africa. Thank you for joining our webinar tonight with Dr. Satya Sardonicus on sympathetic dominance, NeuroFascial integration and laser therapy webinar, part 1. I would like to introduce our wonderful new speaker, Dr. Satya, Doctor, Health Strategist, Author, Chief, and Erchonia Laser Owner. Dr. Satya Sardonicus is a strategic healing consultant and founder as a Fascial flow method, a groundbreaking body-based approach to unwind stored tension and become more resilient to life's unavoidable stresses. As I said, I would like just to cut really short this. I mean, Dr. Satya, you know already about the information's being sent through our invitations to you all. We will be happy to assist you further at the end of the webinar, which for your reference will be recorded and sent out to all the attendees. I would like to alert you to the questions and answer box at the right-hand side of the screen, which you can use to type in your questions to Dr. Satya. We will be addressing these questions at the end, but please type them in as we go along. So without further ado, over to you, Dr. Satya.
Thanks so much, Jasmina. And with the questions, Jasmina, if you're keeping an eye on that and something is about a clarifying point for something I'm saying, feel free to interject.
I will.
I know these things, I'm here for you all, so if something is relevant to the exact thing I'm talking about, I'm happy to take those questions as they come. But if it's not, then I will definitely stay for
questions here
at the end as well.
Yeah.
Thank you so much. And so as you said, I'm Dr. Satya Sardonicus. I'll just give a very brief bit of my background, how I'm here. I am the 7th chiropractor in my family, in a family full of holistic healthcare providers, including craniosacral therapy, rolfing, structural integration, massage, etc. And so growing up in that environment, I have a unique perspective on the healing process, such that when I started having chronic health issues as a teenager and into my young adulthood, that was the place from which I addressed and moved through those challenges. So that's just a little bit of tiny bit of background. We may go a little more into my story as we go, but let's dive into sympathetic dominance, neurofascial integration, and laser therapy. Stress and trauma are impacting the majority of people we see today, and probably the majority of us as well. And this has been the case for as long as I've been in practice, well over a decade, but especially the past several years. So chronic sympathetic dominance inhibits change receptivity, it slows the healing process, and it creates a bracing resistance to therapeutic input from us and all other providers. What we're going to do through this series, which is both today and next week, it's a 2-part series, is give you a unique lens to the healing process that will allow you to look at what's going on with your patients, stepping back and saying, okay, there's a gestalt, something that we can put together of the pieces, and give you a lens to the healing process that will amplify your clinical impact for more consistently powerful results with a lot less effort from you. So let's dive in. Well, the big problem that we are faced with is this chronic stress and chronic trauma. And when I say stress, I can mean emotional stress, but I also mean the physical stress of sitting at a desk and being hunched over and on our phones with our mechanical stress, right? It's also the neurological stress of insufficient sleep. It's also the chemical stress of too much wine and sometimes medications and eating inflammatory foods. There's a whole host of kinds of physical, chemical, emotional stressors, as well as when I talk about trauma, that can mean, yes, some huge, overtly traumatic incident, but we can also have micro trauma. And the thing I often think of with trauma is that it's very universal. It varies only in type and in degree, but trauma is something that we are seeing throughout people's lives and has to do not with your experience of what happened, but more so your capacity to handle it based on your resources. And so what we're looking at today is a lot around the neurological resourcing, which of course reflects through into the emotional as well. So when you're in this prolonged state of stress, it's called sympathetic atonia. This is the technical term you can find when you're doing literature searches. And it basically means that the sympathetic arm of the nervous system is in a dominant state versus the parasympathetic for a prolonged period of time. Now, when I was a child, I was in a car accident where I was stopped and rear-ended at 80 kilometers an hour. And we think that that's probably when my brain actually got herniated out of my skull, out through the foramen magnum into my neck. But we didn't know that until I was 26 years old. So I was mysteriously ill from 16 to 26 with weird neurological symptoms and progressive pain, anxiety, a lot of like positive pathological reflexes. When I was in chiropractic school, they used to use me as an example. So that's sort of my background into this, but then I chose to specialize in pediatrics and sensory processing. And so what I started to notice as I was recovering from my own brain injury was that my experience and the experience of these kids with autism, dyslexia, ADHD, etc., and their stressed out parents, we all had some parts of our symptoms that were very similar. It's like this Venn diagram crossing everything. And in the center is this heightened sympathetic dominance. The other thing that we really need to recognize is that 1 in 5 people today, 1 in 5 people are diagnosed with anxiety. Now that's just official diagnoses, right? I'm sure it's much higher when you talk about people who are just experiencing anxiety on a regular basis. We are seeing more than ever children trying to commit suicide, having to have 5-year-olds on antidepressants. It is pretty heartbreaking what I see in my practice and possibly what you're seeing in yours. And if you're not seeing it, it might be because you're not taking care of kids, or I don't know, I'm very grateful if you're not, but this is a huge challenge that we're seeing. And we know that stress is implicated in 80 to 90% of illness across the board. This is something well acknowledged. So even before the car accident that I had, talking about chronic pain and progressive neurological symptoms, these are the kinds of things you might see in your practice that are going to make you think this person might have sympathetic atonia. So the thing that needs to happen in order to recover, because we can recover, right? The body is self-healing, the body is self-regulating, and there is absolutely a way to get out of the hiccups-like loop of sympathetic dominance, of sympathetic atonia, and that is neurostructural fluidity. So think about if you smash your finger in the door, what's the first thing you want to do, right? You want to shake it, you want to maybe curse, but also squeeze it, right? Because shaking and deep pressure squeezing send proprioceptive feedback to the brain. It races the nociceptive alarm signals, gets to the thalamus faster because it goes on faster nerves, right? And so it wins and decreases your pain, decreases anxiety. So the natural way that we come out of fight or flight is movement, is proprioception. Fascial dysfunction is a major overlooked and underappreciated component of our work as chiropractors. People with sympathetic dominance can be helped by really focusing on the fascia as a window to restore autonomic balance because it is highly innervated with proprioceptors. So stress and brain function is really how we can meet patients where they are in their symptoms while still staying congruent in a philosophy that says the body knows how to heal itself. We just need to figure out what it needs to recover. So the way we can reduce that chronic sympathetic dominance, as I said in the previous slide, is by restoring the proprioceptive and nociceptive balance. So chiropractic adjustments, of course, are going to loosen stuck joints, which will allow them to generate the proprioception they're normally generating in your day-to-day movement. It will also decrease the nociceptive or alarm signals that come from those stuck joints. Fascia can be used to stimulate proprioceptive feedback, and we can also use low-level laser therapy. The red and violet is an excellent combination for this, to help restore the sympathetic or the parasympathetic baseline at rest. And the laser we'll talk about today can be used mechanically to influence fascial adhesions and can also be used neurologically directly into the sympathetic parasympathetic balance. So fascial input and low-level laser therapy are especially useful when the spine is unavailable. If somebody has so much bracing and so much guarding in their system, you don't want to just push through that, because you could actually end up creating an association, a negative association in the nervous system with, oh, that change felt unsafe, right? And so it may actually amp up the sympathetic response. So if you're struggling to find a window in through the spine, you can start with the fascial input, you can start with the laser therapy in order to get that window of access. It's also going to conserve your energy so you're not pushing so hard. And of course, adjustments will last longer because they're not just going to snap right back. Because if the body feels unsafe when you try to make a change, even if you're successful at loosening it, it will want to go right back, which is why we see a lot of, I need to adjust the same thing over and over. Now, of course, there's such thing as repetition to retrain existing habits. So if something has been stuck for a very long time, of course, it may need a series of adjustments, but you can get those adjustments to hold longer and be able to taper back more quickly and stabilize the area if you can make sure to bring down the sympathetic response. So let's dive into how it works. First, understanding sympathetic dominance itself. So sympathetic dominance, wow, there's something loud outside, sorry about that, guys. So sympathetic dominance, in the visceral system, we are going to see things like an increase of heart rate. We're going to see more vasoconstriction, more blood pressure elevation, glucose, blood lipid, all of this is going to be elevated. Cholesterol, it's a precursor to make stress hormones. These are all normal, right? This is just a little refresher on a normal fight or flight response that happens in order to assure your survival in a dangerous situation. We're also going to reduce reproductive and sex function. We're going to reduce growth function, reduce cellular immunity, the Th1 that's going to fight infections and cancer, because those are long-term threats. And the brain says, instead, we're actually going to activate Th2, the itchy, sneezy, wheezy allergic type of the allergic arm of the immune system, because that could be a more life-threatening situation. We're also going to inhibit digestion. That's not an important thing if I'm trying to fight for my life or run for my life, as it may be. Neuropsychologically, we're going to see a great increase in feelings of stress, fear, anxiety, depression, and we're actually going to see an inhibition of logic, short-term memory, and compassion. So compassion is neurologically inhibited when you're in a state of fight or flight. That's because if you were busy being compassionate for the tiger, you might not fight for your life, right? So it makes sense. But again, when we are in this state for a long period of time, how many chronic health challenges am I naming, right? High blood pressure, reproductive challenges, etc. Other things we're going to see also include an increase of emotional learning and instinct. So, for example, if anything ever brushes your leg again in the future, you might go right back into this fight or flight response, because it might be that you're in the tall grass where the tiger attacked you last time, right? So we struggle with like remembering somebody's names, learning math, but our emotional memory is hyperactivated. We're going to have more sensory sensitivity, we're going to have more irritability, and overall difficulty sleeping, because you don't want to sleep through the night if the world is dangerous, and a decrease in sex drive. The biggest thing that's going to impact our work directly as providers is that the capacity to incorporate change, to receive change, therapeutic input is inhibited. because all change is challenging, even in the right direction, right? All of it. This is why, think about the last time you were in a fight with your spouse or friend and you felt attacked and made wrong. How interested were you in changing your mind to that person's point of view in the moment? Maybe later you reflected and you were like, actually, that was kind of a good point. But in the moment, our brain blocks us from change, right? So how this is going to affect our clinical work is that if somebody's nervous system is in a state of sympathetic dominance, it's going to be very difficult for us to get the therapeutic results that we want. And even if we're able to do the change, it's still going to slip back. It's not going to be very stable. So the problem is we really need that window of access to create change receptivity. So when I think about, chiropractic miracles, right? These stories of amazing results. When I first started in practice, I was like, well, how do I do that on purpose? How do I get that more consistent, right? And one of my favorite quotes is, magic is just science you don't yet understand. So when I think, oh, chiropractic miracles, they're magic, I was like, well, how can I understand the science? And this piece about sympathetic dominance is such a game changer. So I'm excited to share this with you. Let's keep going. So our two biggest roadblocks are to those miracles, to having consistently powerful results, not just, oh, this happened in this case and that's cool, but how do we get that more frequently, is sympathetic dominance, of course, and structural restrictions to fluid movement. Now, of course, they're connected, but let's get a little context. Fascia is a powerful window to neurostructural change because it is the scaffolding for the entire skeleton. It starts in utero, embryonically, we start developing these fascial lines through the body where it's like all the muscle cells are close together inside the matrix of fascia, and the fascia is attached to the ends of the bones, and as the bones grow, then it stretches and the muscle cells get closer together, and that's why we have the endomysium, the epimysium, the paramysium, right? In our textbooks, it looks like, oh, you have this big cross section and it has a neat envelope around it, and then there's a littler section with an envelope and a littler section with an envelope. It's not that neat in the body. It's more like spider web. You can actually see this is a scanning electron microscope photograph showing cytoskeleton, that the green with the blue in the center. This fascial network is very much like a spider web in the body, and it provides the scaffolding. So when you think about what is the support structure of the body, we think bones, right? And then the muscles move it. And we don't learn a ton about fascia, but at least we didn't in my school. I don't know about you all. But if you think about it, if you saw an x-ray of a knee and the bones were touching, what would you think? That's bad, right? Then they're grinding, that's not good. The bones are floating. They're floating. So we can't actually have the skeleton be totally the support structure of the body. It's the fascia that is giving the tensional integrity, that is suspending and holding everything in relationship to one another. That is the scaffolding. That is really important. And so when you have any adhesions, you have tension lines, you have anything restricting the normal fluid movement of our fascia, it can actually hold osseous subluxation patterns in place. It can hold restrictions in place because just like pulling at the edge of a bed sheet, if you pull on fabric, it pulls across. So if something up here is stuck, but there's fascial tension down here and I try to adjust this, I'm fighting the fascial tension. And even if I get it, that's probably why it's going to snap back as well, because you haven't alleviated the fascial tension. Now, there's not always fascial tension with every single osseous restriction, but it's something that we need to understand contextually. Fascia also has a very high density of proprioceptors, 6 times that of muscle. Of course, we also have proprioceptors in our joints as well, which is why we focus on the skeleton. But fascia has a very high proprioceptive density. And interestingly, that I'm just going to give an honorable mention here, is that when you look at, out of Chinese medicine, the lines of where energy moves in the body, the energetic channels or meridians, and you look at a map of that, which is what is on this person at the bottom of the screen. And if you were to overlay that with where there are lines of fascial density in the body, they're actually really similar, which has led to some scientists proposing that fascia might actually be the intersection of our physical and energetic bodies. So there's just a little food for thought that I'm going to move right past. So we can use this NeuroFascial interface with the proprioceptive feedback in the fascia to decrease the sympathetic response and improve our ease of adjusting and how long our work lasts as well. I would like you to consider the caterpillar, who, if you don't know, turns liquid inside the chrysalis before turning into a butterfly, completely liquid. Trauma feels like everything's falling apart. How many of us have had our lives upended and it felt like everything's falling apart? And ultimately, that allowed you to rearrange into your next iteration. The initial response of trauma is to brace, is to freeze. That's normal. But the most powerful way forward is through the intentional release of our frozen bodies and a conscious return to liquid, that state of neurostructural fluidity where the joints and the fascia can articulate smoothly, which then is going to mirror into our neurological adaptivity. As I mentioned earlier, the normal recovery from a sympathetic trigger is proprioception. So that deep pressure, that shaking, this is what's going to recover a healthy autonomic baseline following a stressful trigger. I'm going to repeat this. The way that we come out of fight or flight response, the way that we recover from a trigger is through proprioception. It's the built-in mechanism. So trauma causes bracing that distorts the proprioceptive and nociceptive balance because we have now less proprioception because we're stuck, and we have more nociception saying, help, help, I'm stuck. So even if nothing else magically ever stressed you out, if you have restricted joints, if you have fascial adhesions, if you have anything restricting the neurostructural fluidity in the body, you have necessarily less proprioception and more nociception 24 hours a day. This is the #1 reason why chiropractic helps so much, I think, is because when we loosen stuck spots and we restore the body's capacity for neurostructural fluidity, then when you're just moving around in your day-to-day life, you're actually getting the proprioceptive feedback that you're meant to. So obviously, we need to loosen what's stuck in the body, in the joints and in the fascia. Laser is really cool because it can help on a neurological level and on a structural level. So the ultimate solution we want, of course, restoring structural fluidity, but we can't force it, okay? Because that could brace, that could re-traumatize the nervous system. So we need to activate change readiness first, okay? So that's the parasympathetic nervous system needs to be in charge. So change readiness is really necessary because it's adversely affected by sympathetic dominance. When we're in defense mode, we can't also be in growth mode. Right? This goes back to cell biology. I think I first learned this from Bruce Lipton, that even on a cellular level, cells can be in defense or in growth, not in both at the same time. So we influence that change receptivity, that parasympathetic shift with both laser and with proprioceptive feedback. Then we can loosen the adhesions. We can loosen them with laser, we can loosen them with fascial therapy, and of course with adjusting. And then we need to practice the neurostructural fluidity, which there are fascial flow exercises that I've developed. I'm happy to share at some point if you'd like, but any kind of fluid movement where you're articulating through the body, through as many joints and places as possible. This is how you're going to restore that parasympathetic baseline. Laser has, this is me, laser in my brain, laser has a direct influence on brain function. So we'll talk the neurological side first. There's just a few studies I wanted to throw out here. There are so many, and it's something I actually really love about Erchonia specifically versus any other laser I've ever come across, is the exhaustive amount of research that they've done. And just in general, the amount of research on low-level laser therapy has been really powerful, because I like to see that I'm getting the results in my practice, that it has helped me tremendously. I experience it, and that we have some research to be able to understand what it is that's going on here. So I'll just give you a few studies. I know we have a short time today, but here's one that I love, where we were looking at autistic children. A year after finishing low-level laser therapy, we were still seeing that it is helping with irritability. We're still seeing that it has this long-term effect. So that's a pretty powerful thing as well, because it's able to reset the brain. It's able to actually retrain the brain. So that improvement in irritability sustained a whole year later. Vagal nerve stimulation can be done with low-level laser therapy, which is pretty powerful for seizures. But the thing that I loved about this is that we were seeing mood improvements sustained 6 months follow-up. Again, this is a more long-term stabilizing in the brain, changing the neurology. So this was independent of the anti-seizure effects as well in this particular study. The other things that were really stood out to me from this study is looking at the improvement in psychosocial function, the improvement in attention, the improvement in temperament, and the ability to cooperate. Now, these are all things that are very much tied in with that autonomic balance. The other thing to note is that electrical vagal nerve stimulation has been shown to be helpful, except it's invasive. Laser is non-invasive and it's safe. And the effects that we are seeing, antidepressant effects sustained 6 months later, kind of a win. Very much a win.
Hi, Dr. Satya.
Oh,
sorry for interrupting. I've just got one question from one of our attendees, if it's okay with you.
Sure.
So it's asking when you can use EVRL, and which protocol do you use for the parasympathetic system?
Oh, you're so excited, and I'm so ready.
EVRL, which protocol do you use for parasympathetic system?
I know you're so excited for that. So I should have been more clear. Today I'm doing all of the theory and background, and in part 2 we're doing all of the clinical applications. So that's when we'll go through what you need to be measuring, what your objective measures are, as well as what are all the protocols. So I will go through that in part 2. Thank you.
Okay. So I've got another question from Susan Williams and it says at what age can low-level laser be used? Also in newborns?
You know, I'm not familiar of research that young. I have only used it on like school-age children and up. So I don't know the answer to that. Maybe somebody at Erchonia has a comment. Yeah.
Okay, thank you. That's all for now.
All right. So here's another looking at the autonomic effect of vagal nerve stimulation, this one specifically using low-level laser, comparing red-violet and red-violet together, which is the best. Using red-violet together, which is the EVRL device, which is the one that I use, that is going to be very helpful in giving a clear parasympathetic dominance. It's also really helpful, showing in this study, for preventing tissue death, for helping with pain, decreasing inflammation, working with traumatic brain injuries, stroke, autism, etc. And moving a little bit more into the mechanical effects, here's a study I found showing decrease of inflammation and fascial adhesions. So this is actually 2 studies, because what we're looking at here is the anti-inflammatory effect, the immunomodulatory effect, and specifically one of them was looking at lung inflammation and airway remodeling. But the thing that really struck me about this is the pulmonary fibrosis, that we're looking at advanced fibrosis actually being able to be reversed because of those cytokines being impacted positively through the laser. And then in the other study, we're again looking at fibrosis and minimizing inflammation and minimizing the maturation, the development of collagen fibers as well. Oh, actually, one more thing I wanted to say on this last slide. When we see this anti-inflammatory effect to fascial adhesions, of course, that's going to help with structural fluidity, therefore helping with that proprioceptive and nociceptive balance when you move around. I will say that you can use the ligament settings if you have the settings manual for fascial tone. So if you're going to shoot at fascia, then you can use the ligament settings. But as I said, I will go into all more detail on the protocols in part 2 when we do clinical applications of this work. The biggest thing that we're looking for here is an interrupt of the pattern, this hiccups-like loop. We want to interrupt it, right? Just like if you have hiccups, you might drink some water or get startled. We don't really want to startle people out of a sympathetic loop. That probably wouldn't work. But using the laser, using the proprioceptive input can help us interrupt that energetic bracing that we often feel when somebody is just like, can't let go. They can have physical bracing of tension, but also, you know, it's almost like it feels like you're touching the wrong side of a magnet. It's like their body doesn't want you in there. That can be interrupted especially well with the laser, using brain settings for anxiety, PTSD, parasympathetic activation, etc. When you integrate this work, it affects not only your care results, but also the results they get with other providers, which is pretty powerful. I'll share one quick story with you. I had a little boy about 10 years old in my practice years back, and I had just moved to a new state. So this was a new practice. And within 6 months, I had a waiting list only practice because the OT clinic, occupational therapy clinic that he was also being treated at for the year even before he saw me and still through my care, they referred everyone in their practice to me because of what happened with this boy. So this 10-year-old boy with ADHD, and I think he was mild on the autism spectrum, he was under my care for about a month when the OT clinic called me and they said, what OT exercises are you doing with him? Because we did our assessment in the last month. We have seen more improvement than he made in the last year under our care, even though by our measures, he had done well over the last year. So what are you doing OT-wise? I said, literally nothing. But brains don't want to learn new things when they're in sympathetic dominance. What I had done was help to modulate the sympathetic dominance, get his autonomic nervous system balanced, and he made leaps and bounds with a different kind of therapy because he was now more receptive to that work. Another really cool thing is he came in proudly one day, a couple weeks into care, and said, I understand fractions now. Like he was struggling a lot with math at school and something had clicked into place. Now, of course, this work isn't teaching math, right? But we talked about the brain's ability to perceive and process higher functions, higher cognitive functions like learning math. So that has helped quite a bit with him. And it's also helped me quite a bit with the brain injury that I've had, just doing this work of bringing down sympathetic dominance. Ultimately, this is my favorite poem I always like to share whenever I teach, is I stand on the sacrifices of a million women before me, thinking, what can I do to make this mountain taller so the women after me can see farther? Of course, I include everybody in this, not only women, but I wasn't the poet that wrote this. Really, I know that I'm just sharing with you things that I've learned thus far, that I've learned from my family, that I've learned from teachers, that I've learned from over a decade in clinical practice, in the hopes that you can take this work and maybe I'll be attending something you teach in the future. I am honored to be here. I am grateful to Erchonia for being so dedicated to our clinical education and excellence. So thank you so much for having me. And I look forward to seeing everyone next week, January 10th, same time. I would be delighted to connect with anyone on social media. Here's my contact details or email. If you have questions I didn't get to, I mean, I will stay right now for a few Q&A, but if you think of something later, just feel free to reach out. And ultimately, just thank you all for everything that you do to support your communities, because this is something that we can only do all together.
Okay. Okay, thank you very much, Dr. Satya. I've got one more question from one of our attendees, Sasha Langman, and she's asking any research on epilepsy?
I don't know. I will always be the first person to tell you when I don't know something. I don't know if we have research on epilepsy. Oh wait, no, we did, because that one that I went through was about seizures. That one study I had, and I'm sure there are others, was actually about seizure activity. Let's see, where was it? Yeah. This was with refractory seizures using vagal nerve stimulation. But this, I think, was electrical. But then we had this other study using low-level laser therapy for vagal nerve stimulation. So if you put those together, I don't know if we have any laser therapy with seizures. We probably do, but I don't know it offhand.
Hi guys, actually Jasmina, at this point, I'll just quickly cut in. It's Simon here from Erchonia. Yeah, we will try and find out that, Sasha. We obviously will go on to PubMed. We haven't got any specific research ourselves, but as you know, there's a lot of other research out there that hasn't been done by us that we can also make reference to. And if I can just answer one more question, which was about the age you can use low-level laser.
Yes.
From a company perspective, within our studies, the minimum age is 18. However, we do know a lot of clinics will use lasers on patients as young as newborns. As a company, we can't advocate to that because we don't have the clinical evidence to back that up. But this is where it's important to actually understand the differences in low-level laser in the mechanisms of action. So if we go into infrared, which is higher in wavelength, delivers a little bit more heat, then obviously we would be very careful on how we actually use that sort of low-level laser. But the Erchonia lasers are non-thermal and they fall into the visible light part of the electromagnetic energy spectrum. So there's no reported side effects, no reported adverse reactions, and they're renowned for being very safe. So I'm sure we can get back to you individually after speaking to our clinical consultants, but all I can say is I know a lot of our practitioners do use the lasers on very young individuals. So I hope that helps.
Okay. Thank you very much, Simon. And Dr. Satya, I've got one more question from Neil Chandler. What is your technique of choice for facial release?
So I actually, because of my brain injury, I was too sensitive to any of the existing kinds, and I ended up developing some work myself. So that is actually NeuroFascial integration is a technique that I teach. It's a modification from Rolfing structural integration, Graston. Those are all I find to be very aggressive, but if you can do them as if you think you were working on like a newborn, even for adults, that's the easiest kind of shorthand I can give you for how I've adapted that work. Yeah.
Okay. Thank you very much. Let me just have a look if we have some other question. Yeah, I think that's all for today.
Great.
Okay, thank you very much, Dr. Satya. Very insightful indeed. I would like to thank you for hosting this webinar, and for those that have attended tonight. Recordings of this webinar will be sent to all the registrants, and if you have any further questions, please let us know. Just a reminder that Dr. Satya's webinar part 2 will be on the 10th of January at 6:30 p.m. And for those who haven't signed yet, please do so. Looking forward to see you all there, and have a great evening, and thank you very much for tuning in. Bye-bye.